Well, I would like to welcome everybody to the League of Women Voters Chaffey County January meeting. And this is on mental health. I'm not going to do a bunch of introductions. They can introduce themselves, but I want to welcome from NAMI, the National Association of Mental Illness, Eunice Collette, Rita Shoup, and Kirsten Wolfsberg. And from Solvista, Mandy Keisner. So we have given them all some questions that our members have submitted. So the format will be, I think we'll just start with Mandy, and she can give us a little overview of Solvista and answer a few of the questions that were specifically directed about Solvista. And then we'll do the same thing with NAMI, and they can decide who wants to do the broad view and then who wants to address some of those questions. And then we will have more general questions, a list of those that we will prompt folks to answer. And if you have additional questions,
no.
Rita, it might be you. You might need to mute yourself, or Wendy.
So should you try checking with IT?
Okay.
I've never been able to get Zoom to work.
Let's see who else. I'm sorry, we're recording and I'm getting some background.
But I use
People are not on mute.
you know, them.
I'll mute you and I will mute Wendy. So I have control. And Sandy, I'm going to mute you. There. I didn't know I could do that. All right. So then we'll just go ahead and get started. If you have additional questions, please write them in the chat. We might not get to everything. All right. So I'm going to try to spotlight Mandy and we will get going there if I can find her. There we are.
Hi, everyone. Again, I'm Mandy Keisner with Solvista Health. I have been with Solvista for almost 17 years now. Came to this valley, started working out as a clinician up in Lake County, lived in Buena Vista, and then most recently in the last 2 years, have become our Chief Operating Officer and Interim Chief Clinical Officer for Solvista. So I'm really happy to see that mental health is a conversation. I think, especially in today's time, it's a really important conversation. And we need all of our communities to be having this conversation. So I'm really very happy and honored to be here with you all today, and also as a member of your community and a mom in this valley. So thank you for all that you do. Solvista is the local community nonprofit mental health center, which covers behavioral health as a whole. So the term behavioral health is really just referring to both mental health care and substance use care. And this coming year actually celebrates our 60th year serving this region. So Solvista, formerly West Central Mental Health Center, has been serving Lake, Chaffey, Fremont, and Custer counties for nearly 60 years. So super exciting to be a part of this valley and serving this region. So the things that we provide are anything from individual family therapy, group therapy. We have been providing crisis services for a number of years to this valley. Crisis services also, by the way, has just in the last 3 years now been funded, and it's a separate contract that's provided by the state, and we are the holders of that contract. We are also building a regional assessment center here. That was one thing that I personally attended several meetings when I first came to the valley with all of our first responders, law enforcement, EMS, hospitals. And one of the things that I've heard repeatedly was the need to keep people in our valley, especially when they had acute mental health, behavioral health needs. And that's one thing. The Regional Assessment Center is being built on Heart of the Rockies campus, and that will provide both substance use withdrawal management services, as well as acute stabilization for mental health issues. And Yeah, so that's an overview of what all Solvista provides. Most recently, we also have been providing disaster response services. So many of you I might know from the Decker fire response, and then most recently have been working with a lot of small businesses to support them during the pandemic response with workforce shortages and things. We were able to secure a federal grant called Colorado Spirit. And that's some of the work that's been happening within that program, is to provide support for businesses and any members of our community who might need support through this pandemic. Our disaster response is really something near and dear to my heart, and that's something that I also continue to do directly for this community. So for example, besides a disaster event, when we have a community tragedy or loss, that's something that will typically get called in. And then there are several of us on the team that have some trauma expertise and experience to come in and provide some support so that we are preventing mental health issues from happening and really promoting resiliency, which is really such an exciting time where we're really focusing more on what it means to focus on resiliency and promoting people to remain well versus only treating people who have become unwell. And so that's a really exciting shift, I think, that I'm seeing in the community. I see there's some questions here. Should I start with the questions that were given to me, or do we want to do a NAMI overview first?
It kind of makes sense to answer some of the Solvista questions first to kind of keep it grouped together. That's my suggestion.
Awesome. So I went over what the Solvista facility will provide. Again, that's going to be a 6-bed unit for withdrawal management and a 6-bed unit for acute stabilization. We would like to keep that treatment facility as flexible as obviously licensure will allow. And so that's why we thought more of a dual use, a multiple use facility would be of more use to our community. And this, again, these conversations have been happening in this valley about bringing this type of treatment facility here among first responders for about 14 years. We have so many resources in this community that are devoted to taking people outside of this community for acute stabilization when there's a substance use issue or an acute mental health condition. And that's really what we hope will solve the majority of our need here in this valley. So that's something that's really exciting. Is Solvista doing telehealth or screening for therapy? Yes, we are doing quite a number of telehealth services. So back in the beginning of 2020, when this whole COVID situation happened, we literally went remote overnight to just sort of brace and figure out what we needed to do. And then quickly moved back into about a 50-50 half-time in-person services, half-time telehealth services. And we get data each and every month on how much of a percentage of people are engaged in telehealth versus in person. And it's remained about 50-50 overall, 40-60 some months, but on average, it's been about half and half. And obviously that varies between what's going on with the pandemic versus people's own health issues versus our own workforce need, right? We're all also parents and, out there in our community, we've got spouses, partners doing other things. So that obviously with the math, the COVID math, if you will, once someone has been exposed, then you end up needing to go remote. And we've just been really trying to be flexible and also listening. The most important thing is listening to the needs of the people that we serve, obviously, and what services we're providing where. do we have a working relationship with law enforcement? Yes. I would say that's come a long way since I first started back in the day. I would say that relationship was not as good when I first came to Solvista, and we have really worked on that. Most recently, one of the projects that we're doing with law enforcement is to bring a co-response program to Chaffee County, which is very exciting. So co-response is literally having a trained master's level clinician and ideally a peer as well, someone with lived experience with a mental health or substance use condition, then paired with law enforcement response. So any of those calls coming into 911 dispatch that may have a behavioral health type component, we would like to ideally co-respond as mental health and provide stabilization on site with law enforcement and divert law enforcement from the scene as quickly as possible. So we don't want the primary mode of treatment for people being in the highest level of need for crisis services with a 911 call to ultimately be getting law enforcement treatment. We want those individuals to be getting the specialized treatment that they need. So again, this is a very new program. We are meeting routinely with law enforcement and as well as EMS and other our dispatch team to try to refine that and get that working. So that's the most recent project that we're doing with co-response, and obviously bringing this regional assessment center is another large project that we've been working on with our first responder community.
Mandy, does that mean, and you might have addressed this, that people who arrested for DUI or substance abuse, to my knowledge, they previously had to be taken by law enforcement to Alamosa. With your new facility, will they be able to stay here?
Yes, there is actually going to be a separate entrance for law enforcement and first responders. That's more private for those individuals experiencing, again, that acute level of involvement with law enforcement, involvement with EMS. So that way, again, our goal is to get those individuals back out into serving our communities within 15 minutes or less. And then to keep those individuals here. Sometimes there are people who have ingested a certain amount of alcohol, for example, which is a deadlier type of withdrawal that will need medical detox. And so again, that level of care will still be provided by Heart of the Rockies in those types of circumstances. But yes, for those people meeting criteria for us to legally treat them in a withdrawal management type facility, we will take those individuals versus law enforcement having to drive 2 hours, dropping the individual off. And then it's also a requirement of that detox for us to go back and get that individual. So then law enforcement was having to go back the next day to provide that transportation back to our valley. So yes, the answer is yes.
Great. All right, one last question for you, and then we'll move on to NAMI here. What is your funding? Where do you get your money?
That's a great question. About 80% right now is from Medicaid billing. So we provide services that are then Medicaid reimbursable, and that's about 80% of our funding. The other funding comes through us applying for grants. So for example, the crisis contract is a separate funded contract. Again, we still do Medicaid billing for some crisis services, but then all the other supplemental things that we're doing to maintain that crisis contract is provided by that contract. The Colorado Spirit program, for example, our pandemic response support, that's a separate grant. So if anybody has ever worked on even just one grant, you understand it gets very complex. we manage various grants because there's a need, and there's a need then in our community for us to then apply for that grant to solve that need. And that's a lot of what we have to do in today's mental health world, is really just hear from our community what the need is, and then try to find the funding to be able to provide that. There are so many things that are needed that aren't funded by insurance companies. And, you know, Medicaid is one of the better, but private insurance gets even worse sometimes on what they'll actually pay for and cover for individuals needing care. Particularly all the care management services, connecting them to their physician, and all the in-between things that people need while they're struggling with a mental health or substance use condition. Does that answer that question?
It does, and I'm sure we'll have some more
Sure.
detailed questions later, but I want to give Eunice or Kirsten
course.
or Rita a chance to go ahead and give us an overall of NAMI, and make sure that whoever decides to speak, you are unmuted.
Thank you.
Thanks, Mandy.
Well, I'm Eunice Collette, and I will give the overview of NAMI Chaffee County. I am the outgoing president. I've been the president for 4 years, since 2017, and the executive director. And now Rita is our new president. So I get to wear one less hat. So, and Rita is joining us. She just joined our board recently, within the last few months. So she's still learning a lot about NAMI. And then Kirsten, I invited her to join us as well. And she's new in the community, and she does, she's been doing, well, sort of new, right? Or returning to the community. And she's going to be doing some presentations for us. She's done the mental health first aid, and also taught suicide awareness at the community college. So we're excited to have her involved. And so NAMI has been around. It's a national organization. It's a grassroots organization started by family members back in about 1980. So we've been around for a while, over 40 years. And there are hundreds of affiliates nationwide. And I believe in Colorado, there's 13 affiliates. We're made up mostly of volunteers. NAMI, if you go to their website, nami.org, the mission of NAMI is to provide education, support, and advocacy for individuals affected by mental illness and their families. And so we're really focused on education and the support for family members and for individuals that are living with a mental health condition. And they have many programs. They have many, if you look at their website, many education programs and support groups, presentations, and they provide the training for all of those. And so in NAMI Chaffee County, we offer some of those programs. And it all depends on who we have that has taken the training and is available to facilitate those programs. So currently, within the last few years, we've been providing, one of our main programs is family to family education. And that's an 8-week course for family members. I know one of the questions that we received was, who can attend those family to family classes? And it's really for family members, that someone who is living with someone or supports a family member with a mental health condition. Or it could be a close friend or, someone, anyone who's caring for someone with a mental health condition. And that's, as I said, an 8-week course. We have one coming up soon. I'm not sure exactly when, maybe February. All of our programs right now are online. We developed a mental health crisis planning workshop, and this came out of a discussion with Solvista, actually with Mandy, about 4 years ago when we met and talked about what the needs are in our community. And at that time, and I don't know how that has changed, but there's a lot of crisis happening and a lot of resources kind of being diverted to dealing with the crisis. And so we decided to start this mental health crisis planning workshop that would give family members and the general public knowledge about how to deal with a crisis, how to
Hello,
resources.
what was it?
Oh, sorry. Oh, please mute yourselves, whoever that is.
What kind of plastic hose?
God,
I've got hot water that runs under the floor in the bathroom.
I
Oh,
apologize.
So,
okay,
I don't know who it is.
all right, good.
So wait. Sorry, I unmuted you. Unmute yourself, Eunice.
Okay, so I was talking about our mental health crisis planning workshops, and we do those 2 to 3 times a year. And those are also, we've been collaborating with Solvista. We've been having a team member from their crisis services joining us to answer questions and give an overview of what they do. And so that's been really helpful, and people have really appreciated that. And that's a 2-hour workshop. We don't have our schedule yet for this year, but all of our programs will be posted on our website, and we also send out a monthly newsletter. So some other programs that we provide, we have a family support group. And so this is a ongoing support for family members, and usually would meet monthly. We've tried recently to start a bi-monthly, so twice a month support group. And now because of COVID, that is online as well. There are, on the NAMI Colorado website, there's a list of all the virtual support groups. And so there are, just about every day of the week and different times of the day that people can join a support group. We also started a self-care seminar, and this was kind of an outreach event to the community. And we've done that about 3 or 4 times a year, where we get someone from the community to talk about some aspect of self-care. And that's really been well received. We've done presentations on mindfulness, yoga, nutrition, seasonal affective disorder, things like that. So I was looking for presenters for that, as well as volunteers for our programs, people to take trainings, to be facilitators. We also do presentations in the community, such as what we're doing right now. So part of our mission is awareness, to build awareness, and hopefully along with that, destigmatize conversations about mental illness. And so we are available to do presentations to community organizations. There are a number of signature presentations that NAMI provides training for. And one is called Ending the Silence. And we hope to have someone trained to do that. And that particular presentation is for high school students. So we're hoping to have more of an outreach to high school and young people. And one of the statistics we like to point out is that 50% of mental illness presents by the age of 14. And so it's really critical to learn the warning signs and know, where to find the resources to address whatever's coming up. So some other things that we do for awareness are we have had tables at different events. We've had been at the Pride event in June, the Rotary Ducky Race event, engaging in aging fair. And so we're always looking for people to help us with outreach. And, that's our biggest challenge is getting the word out, that people know about us. We have a newsletter, we have a Facebook page. We have a phone where people can call in and get referrals and information about resources in the community. We have a few new initiatives starting up, community education class, resilience, and we're hoping to partner again with Solvista to provide some kind of wellness and recovery program for the new regional assessment center. And we have new people joining us all the time with great ideas. And so that's what we need, is we need people that have an idea of what's something they want to do and get it out in the community. So that's pretty much my overview. And
where does your funding come from then?
okay, yeah, our funding, a lot of our funding to begin with came from the METAB grant, the Marijuana Excise Tax Grant. We've received that for the last 4 years. And also donations from community organizations and individuals. We do a yearly fundraiser, NAMI Walk, and from memberships. You can also go on our website. There is a donate button on our website. But mostly, we're dependent on donations. We don't receive any funding from our, national or state organization. So we do that all ourselves. We've gotten community grants from the Rotary, from Monarch Community Outreach, banks, Collegiate Peak Banks, High Country Bank, churches, to name a few.
All right.
Mhm.
That gives us a good idea. I am going to spotlight the rest of the NAMI people and Mandy. And then you answered, Eunice, one question about the new program you're trying to get into the schools with the high school kids. And I believe Solvista has something going on with teenagers being able to access care. So maybe you could address that question about any other kind of collaborations that Solvista does with the school districts.
Yeah, we have various projects. So one of the most exciting things I think I've worked on in years was a group, the Extraordinary Youth Council, came to me, I think 3 years ago, and asked to have Solvista sponsor their idea and concept about a youth mental health voucher. And of course, the answer is yes, and we'll figure it out. We'll figure out all the details later. But we instantly had people calling us to offer donations to continue to fund that program. The school district itself donates money to fund that voucher program. So ultimately their idea, and I want to be clear, this is a youth-driven idea. Like Solvista just said yes to providing the service. It's just such a powerful concept, I think, when the people experiencing the problem are the ones who are solving and coming up with the ideas. And I just think brilliant. I'm getting some feedback.
Oh, I know. Hopefully if I hit mute all and then you guys can unmute yourselves. I don't know who's doing that.
Okay. So
Now I'm getting your feedback.
It's often if someone calls in and then also is logging in through their computer. So sometimes they get the double feedback. I don't know if anyone's on the phone while also has their audio unmuted. Sorry. I don't know if that'll help, but.
All right.
thank you, Kirsten. So anyway, the youth's idea was to have 2 sessions with a counselor, either have somebody meet them at the park or meet them at the school or meet them at Solvista, and then provide those sessions. And it doesn't require enrollment, which is also the beauty. You know, there's a lot of bureaucracy when you're trying to receive services, right? There's a paperwork packet that you have to complete, and that makes it a barrier for some people to receive care. And so the youth voucher itself has just been this brilliant, super exciting project. Instantly, in the first year that we did it, we saw a 25% increase in youth services. So I think that's been a real big success. We have a shared position with the school. We've got a separate grant which funds a school-based mental health clinician to go into the schools to provide treatment. And so there is a lot of ongoing collaboration to say, hey, this is what we're noticing, this is our need. And then we come up with either trying to find funding or like this most recent position, we actually are partial funding. So the school is paying for half of the position and we're paying for half the position. And then we'll assess how much that position's utilized. But it's always important, I think, in mental health to just be really innovative and flexible. What we all experience as our need 3 years ago is way different than what we are experiencing in terms of our own mental health needs here today. So it's just important to adapt ourselves to what the community need is driving.
I want to stick on teenagers for just a second. So what happens to teenagers who are suicidal or on drugs? When does Solvista enter the picture? Are they kept in the county or still sent to the Front Range for treatment? So Mandy, that would be for you, I think.
Sure. Well, we have a mobile crisis team. So it really would be a matter of someone initiating a call to our mobile crisis team. So that could either be the school, that could be a family member, that could be the individual themselves. Youth, because of recent changes in laws, youth are able to access care at 12 and older now without parent permission. Again, there are some stipulations with that, but for the most part, they're able to access treatment without parental consent in the state of Colorado. So it really would be whoever initiates us getting involved. Then we would have, again, that's ideally a paired response. So a trained master's level clinician coming out into the community with a trained peer who has lived experience with a mental health or substance use condition, then coming out to provide an evaluation and trying to engage that youth. For youth treatment, yes, if they needed a higher level of care, that treatment would be provided outside of community. We do, if you look at a lot of the research, and, Kirsten might be able to talk more about this as well, but if you look at all the data, hospitalization is not solving a lot of issues. In fact, it's creating more problems. And so a lot of times people ask, man, why didn't that person get hospitalized? It's because the data actually suggests that people are getting worse and getting more acute and having more experiences of feeling like they want to complete suicide immediately post-discharge from a hospital. And imagine what that experience would feel like if you were in crisis and then had to be sent away, not in your community. It's really hard for their family member to communicate with the hospital because of confidentiality laws and things like that. So, and we haven't had a lot of success with the coordination that's needed in bringing youth or whoever's in a higher level of care back into our community. So there's just a lot of gaps there that we really try. And this is thanks to NAMI and other programs as well. Like, we try to keep people in our community to the best of our ability. So if you ever hear someone say, why wasn't that person hospitalized? That's why. It's because the data doesn't suggest that's the best way to treat people.
Kirsten, you want to add anything to that?
Well, let me give a little bit of background as to who I am, so it makes sense. I have, as Karen said, I kind of grew up in the Chaffee County area, back and forth. In 2000, my parents moved up there, so I've spent much more time kind of up there. I've lived in Denver, and so I'm a licensed professional counselor in Denver. 17 years I've been working in crisis services in the emergency departments all over Denver. For the last 15 years, I've been the clinical supervisor for the Centura psychiatric assessment team. So we focus on all of the evaluations in the emergency rooms at all Centura facilities, all over Denver, and also Summit County. We started doing the evals in Summit County. Mine Springs used to do that, but then my team started to do that a couple of years ago. So my focus, my niche, if you will, has always been crisis. And in the last 10 years, I've focused more on teaching clinicians how to do psychiatric assessments. I've been in charge of the internship program on getting new clinicians out there and trained and to learn what to do and how to handle crisis. Part of clinical training is of course, how to handle therapy, how to do mental health treatment and whatnot, but very few clinical programs actually have crisis training. So it's usually something that has to come on the job. So that's what I would provide, was all the training. And then in the last 5 years, I added to that doing debriefings for the hospital staff. I also did all the debriefings for Douglas County after the STEM school shooting. So I worked very closely with the school system in that sense. And I do a lot of trainings did a lot of trainings for Centura Health, resiliency trainings for the staff, medical staff, et cetera, EMS staff. And I did a lot of the Psych 101 trainings for nurses as they came into the system, specifically ER and ICU nurses. I stopped working in April to better care for my parents. I moved up to Chaffee a year and a half ago or so. And then in April, I stopped working at Centura. So I say that's what I do, but it's actually past tense. It's just easier to describe it in current tense. So that's my background. That's my knowledge is more crisis-based. And so, yeah, when Mandy says about hospitalizing people, one of the biggest things that we did with my team was I trained all of our clinicians. I did the onboarding and really tried to train people out of hospitalizing everyone, especially teenagers. Teenagers are especially swayed by peers. They listen to what other people have to say. And unfortunately, when teenagers are hospitalized, sometimes they have some benefit, but usually they actually learn more self-harming behaviors. They learn more poor coping skills, if you will, because they hear this is what other people used to do and the ways in which it worked for them. And so, yes, we try everything we can to not hospitalize people. Unfortunately, and this is part opinion, but based on my experience working with Centura for 15 years, that after the Aurora shootings, Colorado got a huge amount of money, and they funneled almost all of that money into crisis services, which sounds like a great idea. But on the back end of that, it didn't provide a whole lot in the form of therapy. So I love what Mandy says, that Solvista is trying to keep people out of crisis, because once you get into crisis, it becomes its own little cycle. And so keeping people out of crisis as much as possible, doing proactive services, trainings. And that's why I connected with Eunice, with my training background, to help see if I can do anything in the community to help with training, to keep people out of crisis. So years ago with the shooting, they created a network, especially in Denver, but a huge network of crisis services. And then of course, funding goes away. So those crisis services went away in many respects, but we haven't seen much of a beef up in the therapy section. So I love listening to what NAMI and Solvista are doing in Chaffee to try and keep people out of crisis, especially when you don't have a lot of those resources locally. Porter Hospital was my primary hospital. That's where our inpatient services and all of our services are based. But we work with St. Anthony's in Lakewood, and they would get an incredible amount of people from Park County. And if there was better assessment at the point of contact in Park County, then they wouldn't have transported this patient to Denver, where an evaluation would show that drugs were the primary culprit, if you will. That's why the patient was looking psychotic, that once they sobered up, they didn't need to be in care anymore. So then how do we get them back to Park County? And we also had many conversations with EMS saying, why do you just keep bouncing people back, to Mandy's point? Well, we keep bouncing them because they don't need inpatient psychiatric services. And so if we could do something to try and beef up the point of contact services, then that would be an incredible way to get people the service that they need. It's less traumatizing. It's less financially taxing. I mean, there's a lot of trickle down that happens with what seems like an easy decision. Just hospitalizing someone is often an easy excuse or an easy answer, but that's not always helpful. It takes away services from people that actually may need it. Quite often we have hospitals that are full, and so we can't get people in care. And some of the people that were hospitalized didn't really need that kind of intense care. So yeah, I honestly, I forgot what the question was, but that's my rambling.
So for both organizations, what is the biggest problem that you see in Chaffee County, and how do we address it? Go ahead, Mandy.
Wow, that's a big question. You know, number one, I think I would, as a person in this community, really want, and again, we just received a grant that we wrote. It's a federal grant to start really focusing on suicide prevention. To me, that's a powerful piece that as a community, we need to come together to reduce suicide. So in 2020, we had 17 deaths due to suicide and 19 due to COVID-19. So that's a powerful data point of what we should focus some treatment on or some response on. And by the way, only one of those individuals had a prior treatment relationship. And so we really need to start to think through suicide prevention in a larger context of not just formal mental health treatment, but how as a community we do things like what Kirsten and others do with mental health first aid training, so that each and every one of us, if we have a family member or a community member who's might be dealing with something, we know how to talk to them. It may never even need to come to the mental health center for care, but I would really like to, and again, we are going to be focusing more in the next 18 months on suicide prevention specifically. We're doing a lot of training, community training as well on CAMS. So that's collaborative assessment and management of suicidality training, which really focuses in on more collaboration and discussion with the person experiencing these thoughts. and targeting those issues in treatment, in a treatment program. The other larger thing I think I would want to say is like, we are all so taxed right now. So many of us in first responder roles or other roles have had to carry now multiple roles and positions to the point of absolute exhaustion. So we've all just continued to take on more and more and more as this pandemic has continued, when we have workforce shortage issues and we know we need to open our doors the next day. Okay, let me go in, and I'm going to be the janitor today and the administrative assistant and greeter tomorrow, and then the crisis worker on Thursday, so that we can continue. And again, all of our small businesses have experienced these things, with people not being able to show up for shifts and being afraid of what that means to their business. So if I would say the biggest problem I'm seeing is just just the chronic taxation on all of us, and needing to set better boundaries with our work and personal lives. I think there's going to be a whole shift, and we've seen that with the whole Great Resignation. If you've seen anything in the media about that, a lot of people are just leaving the workforce because I think personally they're taxed to a level where there's just an unrealistic expectation. And I think that, to me, has to shift, and we have to give people just more flexibility and more kindness and compassion to all those people who are just day after day working for our community, and there's not really always a lot of realization of what that taxation has become. So
Right, we need therapy for the therapists there. There are outlets. So just a clarification, the 17 suicides, I'm assuming that's in your whole service area, not just in Chaffey County?
no, that was in Chaffey County.
That was
So
Chaffey
I
County.
haven't heard. So we have a really good relationship with Jeff Graff, who's our county coroner, and I haven't heard where our numbers were for 2021, but that was 2020 information, which ironically, we just applied for this federal funding to start to try to address this as a community. We were told no originally, and then I think the federal funding became more available. And so then just recently we were told yes, and by the way, it's, you need to have all these things in place yesterday.
Yeah.
And so we are sort of scurrying to get all those things in place. Very thankfully, like we needed this funding many years ago. So if anybody wants to get involved on a community steering committee, there will be a community steering committee as part of our suicide prevention process. So if you want to get involved, just email me. I'll put my email in the.
Yeah, perfect. Yeah, and Eunice, I think I put a direct message. If you could put this local, state, and national NAMI websites up in the chat, so people might reference them. And then if anybody from NAMI has anything else about what they see as a different problem in Chaffey, a high problem other than suicide.
Well, I think suicide. So I've recently, upon moving to Chaffey County full time and stopping my work with Centura, I started doing adjunct stuff with Colorado Mountain College, and that's where I was giving a presentation that I met with Eunice on talking about suicide. Suicide is dear to my heart. It's been my professional nemesis, I can say, if you will, for almost 20 years. Another resource, and I don't want to take away from Solvista or from NAMI, but another resource that people aren't aware of is the high suicide rate with ranchers. Apparently, one of the highest in the state would be with ranchers. So I somehow, not quite sure how I did, but I got hooked up with CAMP, CAAMHP. It's Colorado Agriculture Addictions and Mental Health Program. And they offer free counseling, 6 sessions of free counseling to anyone who's a rancher, farmer of any sort. It's not just in Chaffey County, it's all of Colorado. So I think, let me see if I can.
That would be an interesting little article to put out in the paper. And
Camp.
to the Envision people who have contact with all the ranchers or Central Colorado Conservancy.
Let me put that.
While she's doing that,
Website.
do either of you offer programs for the elderly? And if so, what are those? Eunice, anything? Or the elderly, like, you know, if they're living with somebody with dementia or they're frustrated about they can't do what they used to do. And
Yeah, well, we don't have anything specifically for the elderly, but they are welcome at any of our programs, our family to family class, our family support group. You know, there is the Alzheimer's Association. So I believe they have their own support group. So if somebody was looking for support, you know, they could attend our support group or they could attend something like that.
Alzheimer's, actually, the Alzheimer's Association, I'm intimately aware of the
Oh, yeah, you are.
unfortunate lack of services for the elderly in Chaffey County. In fact, a couple months ago, I said over a year ago, I moved to Chaffey to take care of my parents. And unfortunately, due to certain circumstances, I needed to move them into assisted living. Chaffey County doesn't have any memory care units. My father has been diagnosed with Alzheimer's. The Alzheimer's Association has an incredible amount of support groups on their website that, like NAMI, you can, they're free, you just jump on, you can attend. They're one of the only ones that I'm aware of in the area, and they're not even in the area. Chaffey County does not have much in the form of elder care. They have a lot of agencies where people can go and help with yard work, help with housework, but it's not necessarily mental health in nature. They have what's the new one that's in Chaffey now? Coast to Coast or something like that. What is it?
Arc Valley Helping Hands.
No, they help with doing things
Right.
around the home, but it's like a day program for seniors to go to. I don't know what kind of mental health services they offer. As I said, I did an incredible amount of searching, and when I called even in Canyon City to see if they had any providers that would come up to the Salida area, and my family lives in Nathrop, so just past Salida. They said that they have so few workers right now that they are barely able to help their residents in Canyon City. Colorado Springs won't come up this direction. I think that there's one unit when I worked at Porter, I actually used to get phone calls from a memory care facility in, I think it was Gunnison, that wanted to send a demented patient over to our psych unit, which I had to explain to them that it wasn't actually, dementia is not a psychiatric issue. The etiology is quite medical in nature. And so even some of those psychiatric facilities, while the patient may have psychotic behaviors, they wouldn't be helped by an inpatient psych facility. Denver has 3 or 4 senior inpatient care facilities that can do crossovers between mental health and dementia, but dementia itself is medical. So while it has a psychiatric presentation to a certain extent, it is very organically medical. So I really have found that the best resource we have are the support groups through the Alzheimer's Association
Great.
for family members, how to
Yeah.
handle and help. their
Kirsten,
family members.
sorry to interrupt.
Yeah.
I think you're looking for valley to valley.
Valley to valley.
Senior care. Yes.
Yes. Thank you. Thank you. Yeah. It sounds like it's a wonderful day program where people can come and have support during the day. And that helps during a certain phase of Alzheimer's, but ultimately it's a disease that declines. So valley to valley. Thank you.
So how do your organizations, this is probably more for Mandy, how do you interact with the homeless population impacted by mental health? And do you see much of that here in Chaffey?
Yeah, we've definitely seen an increase over the last couple of years in homeless or transient populations. We go out routinely with or without law enforcement or first responders to provide mobile crisis services, trying to engage people, if people need long-term psychiatric medication, we try to assist with those things. But I would say we spend a great deal of crisis services doing some of those things, mostly in the community, visiting various homeless camps and or trying to, again, divert law enforcement involvement with some of the people who have frequent law enforcement interaction.
Okay. I know, Eunice, you mentioned that you have workshops and training, and it sounds like Kirsten will be an awesome asset to help doing training, not only for you, but possibly with Solvista, with them bringing on this other program involving the master technicians and stuff. But what other kind of qualifications does your staff have at Solvista, and how many staff will actually be at the new facility? I'm assuming you'll still have your Salida facility, the BV facility, and then the new facility, correct?
Yeah, so it's a wide range of who we have. So all of our traditional therapists, our clinicians, those are masters trained, either licensed or getting their license in a mental health related field. We also have peer hires who don't have a bachelor's degree, who have lived experience, which is very much of value in its own right. And that has been seriously one of the most effective programs that I've been working with, is having our peer programming. It's been really successful. So it doesn't necessarily, again, the role itself doesn't necessarily have to have a certain qualification. Ideally, people have a bachelor's level in some sort of health or human resources related field is the ideal for things like, you know, being able to get reimbursed for anything.
Okay. And talking about reimbursement, Barb asked, is NAMI or any mental health organizations at any level actively lobbying to try to get private insurance companies to better cover mental health?
Yes, am I muted?
No, you're good.
Okay, well, NAMI does a lot of advocacy at the state and national level, and that's definitely one of the areas that they particularly focus on is mental health parity, they call it, so that it's treated, mental health is treated on equally with physical health. And it's something that we have to constantly be fighting for, you know. It's and my mother was involved with NAMI, and she was fighting for that back in the 80s. So it's yeah.
I'd like to interject just a minute about the League of Women Voters at the state level. They are very active and help with lobbying, and so maybe if you know some legislation that you feel is important to get passed, the league can be an important. I mean, even our members here, we can write and call our representatives. On tomorrow, in fact, the league is having their healthcare committee meeting that they have, but on the 15th of January is the legislative conference. And one of the topics there, in addition to the 8th congressional district, but that's for all members to attend, and it might be open to the public, but they're talking about policing and mental health. And I know that the state league is also working with our legislative action committee to work for laws that will help better, and mental health is part of one of our, behavioral health is one of our big policies that we want to work on. So keep us in mind if there's something that the league can help, and sometimes two voices are better, or 5 voices, 20 voices, 100 voices are better than some,
Yeah, I would suggest if there's someone in particular really interested in that, is to get on the public policy committee of NAMI Colorado,
Okay.
because they send out all of their you know, well, I think they meet monthly and then they send out emails about what they're working on and asking people to write.
Yeah. Great. And if any of you, and I want to give Rita a chance to say something because I know she was really new, but to say anything. And if Kirsten and Eunice, if you want to put your email or contact in the chat, if anybody has follow-up like for that policy committee, they could get in touch with you. And if you guys just go to our League of Women Voters Chaffey County website, you can see the calendar for all the Colorado presentations and just scan those once a month to see if there's anything on mental health that might be of interest in all your free time, Mandy. I want you to do that. There, Rita, you want to say anything here? Didn't want to leave you out. Unmute yourself, or I can unmute you.
Okay, I think I'm unmuted. Oh,
Yep.
like I've already been introduced, I'm very new to NAMI, and my main objective is really to get our name out there in the community. I never even knew this existed until a couple of months ago when it was brought to my attention. So that's one of my biggest things, and to work and meet Mandy, and of course Eunice is going to be my big supporter. She's going to be the foundation to make us successful in 2022 going forward. So you're welcome to reach out to me. I'm getting my feet wet. Right now, we talked about this time in crises. Right now, we're kind of in a crisis as an employer, and with this new surge of COVID. So I've been very much detained in that area. So I appreciate Eunice for stepping in and saving me. Thank you, Eunice.
Okay.
Taking care of me. So,
I want to thank
you,
all
and
of you. Mandy, one last question. When is the facility supposed to be operational?
Fingers crossed for April.
This April?
This April.
Okay, that's
You know,
great.
the shortages and all that, and we
Exactly.
obviously need a lot of staffing, but yeah, that's
I'm not wagering on that.
okay.
Yeah. But I want to thank you all so much. It was, you know, a little challenging to get everybody together a bit, but this was, I think, for me at least, extremely enlightening. And we had one of our biggest attendances for any of our programs. We had 35 people was the max at once. So that's wonderful. I'm going to close our recording and invite any members who want to just stay for a little bit for Margie's updates. And I'd invite those of you who are participants, check out our league's website, and we'd love to have you as members.
Yeah, and they can everybody can stay on.
Yeah.
Nobody has to
Yeah,
leave.
you don't have to leave, but we know some of you have other things.
Yeah, commitments.
Okay, I'm going to end the recording.
Thank you very much.
Wait, no, I don't want to end that.
Thank you.
Thank you. Okay, I'm